Health at home, how community is the key to making a difference. Back to school, healthy eating education from an early age. And going offline, the parliamentary group addressing the negatives of social media. Hello and welcome to A Place for the Public's Health, a programme from the Royal Society for Public Health and ITN Productions. I'm Natasha Kaplinski. In this programme, we're going to be looking at the challenges and opportunities when it comes to improving and protecting the public's health. We're going to be looking at how the places in our lives have an impact on our health, from our daily workplace, at school and home, on holiday, as well as the virtual places. Please join us as we explore the places we live, work and play in a place for the public's health. Where we live, work and play has a big impact on our health and well-being, and this can vary greatly depending on where people are born and brought up. Our reporter met with RSPH Chief Executive Shirley Kramer for this exclusive interview.
The programme this year is called A Place for the Public's Health. How important is place?
Place is extraordinarily important for the public's health and well-being. And we know this because the evidence is very clear that if you live in an area of disadvantage, so a place that has poorer housing and not such good retail and probably less green space and poorer schools, and all of those things affect your health and well-being. So where we live, where we work, where we play will really make a significant difference overall to our health and well-being. And the evidence is very clear that here in the UK and abroad that there are vast health inequalities. And so place, if we can do something to improve place, we can really make a difference.
Social media is portrayed as the devil sometimes, but you're taking a very close look at it, aren't you?
We became concerned last year when we started looking at the evidence base around mental health in young people and the use of social media. So we decided to ask young people, so tell us about your health and well-being in relation to social media. So we produced a report called #Status of Mind, which highlighted the negative and positive impacts. We've now this year started an all-party parliamentary group on social media and young people's mental health, and that's been really good because loads of MPs are very keen to be part of the discussion.
Do you think the government's doing enough to address inequalities?
I would say broadly, overall, no. And the reason for this is partly that they're quite embedded in, over years of austerity. What that's meant is that sort of increased the inequalities. And we know this from Sir Michael Marmot's work at the Institute of Health Equity. So we can see these disparities. And of course, that has a massive effect, we found, on health and well-being. Depression, anxiety, family relationships, and even things like smoking and drinking, classic public health issues. If you do drink, you might drink more. If you smoke, you might smoke more because you're in this, you're having mental health problems. So these are really important issues in place.
We have a wider healthcare community now, gyms, opticians. How important are they?
The Royal Society for Public Health has been the leading champion for what we've called the wider workforce for the public's health. And the reason we think it's so important is that prevention is, in a sense, everybody's business, or everybody who's, in a professional sense, working with other people. There are 40,000 people who are public health professionals in England, but loads more professionals who want to be involved. So we've worked with the fire service, housing, and many others. This year, we worked with UK Active and produced a report looking at gym professionals and exercise professionals and their role in health and well-being. And what's really interesting is how enthusiastic they are to be part of the wider workforce for the public's health, promoting healthy conversations and signposting to support if people need it, and to be thought of as part of this wider group of people who's really helping to prevent ill health.
Well, how do you see the future?
I see the future in two ways. If we're really serious about improving the public's health as a society, we're really going to have to equalise place. We're going to have to make all places as good as the best, all schools as good as the best. We're going to have to really invest in early years, which is where it matters, really invest in schools. And we're going to have to be knowledgeable about what's good for us in our health and well-being, not in a don't do that because it's bad for you, but in a sense where we have a chance to discuss and think about things like social media. How are we going to manage it for ourselves and our children so that we can take a bit of control about our own health and well-being, with the state taking its what it needs to do in terms of bringing up at place, the base and our public institutions that will really equalise our life chances.
London is a metropolitan city full of diverse cultures and communities, but it's also a city of contrast with many different socio-economic challenges. In one London borough, tackling inequalities has become a primary focus. Nick Thatcher went to visit Lambeth Council Public Health to see how they're working with partners and the community to find solutions to improve outcomes of local residents.
Lambeth is a dynamic, vibrant and diverse London borough, but it's also one of the most deprived areas in the country. The council leader here told me tackling what are often deep-rooted social inequalities is one of her top priorities.
Lambeth is a fantastic borough to live and to work. It's got thriving town centres, it's got high rates of employment and it's got really good education. But we do know that in a small borough like ours, a geographically small area, there are still some real fundamental inequalities, and we see that in the health outcomes that people experience. And we know that integral to a successful approach has to be partnership, and that's partnership across the council, partnership with other organisations, and most critically and fundamentally, partnership with our local communities.
Central to this is a health and well-being strategy.
Hi, come on in.
Hi, Doctor.
Dr. Raj Mitra has been a Lambeth GP for more than 20 years and is the chair of the local Staying Healthy board. When it comes to treating conditions like asthma and obesity, he says, the social factors contributing to them also need to be addressed.
I see a lot of problems that are intergenerational. I know that when people come to me with these problems, I can't solve them on my own, that I'll need help from other agencies. So in Lambeth, we have a Lambeth Together initiative, where health and social care agencies work together around the person to provide them with the support they need. So, for example, in obesity, they can go to a group, learn about food, have support from other people who have the same condition, learn about exercise, rather than coming to me and having tablets or being referred for an operation.
And we know that inequalities start at birth, and nearly 40% of children leaving primary school in Lambeth are overweight or obese. So Lambeth Early Action Partnership is working in 4 of the most disadvantaged wards in the borough to give children a better start. Known as LEAP for short, it aims to support the social and emotional development in babies and children up to 4 years old, as well as to improve their communication skills, diet and nutrition.
And the very tall giraffe.
Mum Edith Afram volunteered to help with the summer play scheme sponsored by LEAP and found it also made a huge difference to her well-being.
For myself, it was an opportunity to socialise with other parents, to talk about the ups and downs of parenting. And for my children, it provided a social as well as a learning experience for them, because they were able to talk to other children, learn how to play, and also having somewhere to go to that was affordable, it was nearby, and just going there knowing that people cared about us, it made a real difference to us this summer.
Different communities can also have particular health challenges. People from black and minority ethnic groups, for example, are diagnosed with long-term illness around 10 years earlier than the white population. and black Caribbean adults are more than 2.5 times as likely to have severe mental illness. And to try to tackle some of these inequalities, Black Thrive has created a partnership between the community and service providers, which aims to improve access to and the experience of mental health services.
With collective impact, we're basically equalising the voice of the statutory services and that of the community, making sure that there is dialogue, that it's open, that it's honest, and most importantly, that it's measured and evaluated. And also public health can look and say working together with the community is actually incredibly positive for the outcomes.
Tackling social inequality and improving health outcomes takes time. There are no quick fixes. But in recognising the challenges that remain and by working in partnership with its communities, Lambeth is committed to ensuring all its residents can share in the benefits of living here.
Well, I'm joined now by Kieran Boyle, Chief Executive of Guy's and St Thomas's Charity. Very well welcome. Thank you very much for coming into the studio. So tell me a bit more about your charity and your place-based strategy for dealing with health issues.
So we're the country's largest place-based foundation, and we think place is a really interesting way of understanding the complexity of people's health. So how do you really get under the skin of everyday experience of health? But place for us means three things. So we work in a physical place, which is Lambeth and Southwark in South London. We work in a type of place, so places that are densely populated, they're culturally and ethnically really diverse, and they have high levels of income inequality. But a really crucial bit about place for us is the context of place. So why is it that some streets feel like they're for people or not? Why do people feel like some public services they can use or they can't? And we really try and understand that sort of thing.
What are the kind of issues that you deal with in those places?
Yeah. So we focus on issues like childhood obesity or people living with multiple long-term conditions. And the reason that we do is that different communities experience very, very different outcomes on those. So for example, children in some of the poorest areas of where we live are 2 to 3 times more likely to be obese than children in richer areas. And our place focus is to take a really hyper-local approach. So by that what we mean is we focus on neighbourhoods, perhaps even kind of 500 metres, and say, well, in that 500 metres, can you layer up a lot of different things that can help with every aspect of that complex issue? To give an example, we do a lot of work in a place called Faraday. There's a very old street market there, a food market. And what we've done is we partnered with 6 or 7 different organisations that are helping kids think about, well, healthy eating, helping their families think about cooking, thinking about physical activity. So all of that's great, but what if a family can't afford to buy healthy food? So one of the charities that we partnered with there is called Alexander Rose, and what they do is they give food vouchers to lower income families, and those families can go to the local market and use those vouchers to buy healthy food.
As you said, it's about partnership and collaboration, and that's what ultimately has an impact on long-term conditions as well.
Exactly, it's all about partnerships, and there's a really important shift going on from funders like us to moving to how do we build much more active partnerships with people rather than just giving grants. The interesting thing about working in a place is just how wide those partnerships have to be. So it might be with the NHS, so for example we work with the local hospital around community nursing. It might be with big businesses, so we're working with every single major supermarket in the areas that we work to see if they can promote healthier food to families. And what we're finding from those partnerships is it's almost that 3 different types of impact occur. So there's the impact of the projects themselves, then there's the impact that they're quite complementary, they're helping each other with different things. But the third one's the most interesting, which is that they're all learning from one another about what it takes to be effective in that place, in that location.
And I'm assuming part of that learning is how to engage the different communities that you deal with.
Yeah, absolutely. So sometimes places are kind of a really, really local thing, but take Lambeth. 1 in 6 people in Lambeth speak Portuguese. So it's a really important community to engage with, and particularly because they have more long-term conditions than the average. Now, there's not one place you can go to engage this community, but there are lots of different places. So for example, we engage with local football clubs, because it's a really good way to engage the Portuguese community.
Well, we really look forward to following your progress and wish you the very best of luck. Thank you very much indeed.
Thank you.
School Schools are an ideal place for establishing healthy living habits. Halton Borough Council in the northwest of England recognise this and have brought 100% of their schools onto the Halton Healthy Schools programme. Their integrated wellness service works with a wide range of partners and teachers to deliver this, ensuring both the physical and mental well-being of pupils are addressed.
The first thing children at Halton Lodge Primary School do is get moving. Each school day starts with a wake-up and shake-up session. Lots of fun with some serious health benefits. Halton's leading the way in health and well-being for schools. It's one of the few places in the country where everyone is signed up to its Healthy Schools programme, delivered by its integrated wellness service, supported by Health Lead Counsellor Marie Wright and tailored to each school's needs.
We've got every single school included and they're all very supportive of it. They all make time for the children to join in, and if we can work with children and help them to improve their health and well-being and to feel good about themselves and to feel active and to eat healthily, that then transmits to the home and the parents get interested and eventually it filters out into the community, and so we have a ripple effect and then everybody feels better.
So what does having a lot of sugar do for our bodies?
This school wanted their children to move more and eat more healthily. Today, there's a lesson on making the right drink choices.
Spot on, that's a really great answer, yes.
Taking part, children from the school sports council. It was set up to get children involved in making decisions on how to be active. One of those brought in an innovative approach to playtime, known as the Scrap Store Play Pod. It's an inclusive way to get everyone moving.
The big thing that we have noticed is some of our least active children have suddenly really thrown themselves into it, so they'll be pulling crates along, they'll be rolling barrels, they'll suddenly find other children who've got similar interests to themselves, and they get that kind of physical activity that they wouldn't get at any other point during the school day.
I like in it that there's this barrel that you can go in and you can go around in it, and you have to move yourself to move that, and it's really fun. And now with the play pod you get to play with stuff and it just makes it more fun.
While fun is fundamental, health and well-being is the real target. Through its 5 ways to well-being, Halton Borough Council helps its schools to work not just on the body, but the mind as well.
They're struggling with mental health and resilience right across the board, nationally. So schools are keen to have the advice and information from us. We would come in and suggest different strategies, activities they could put in place, use of apps, different resources, and then embed them into the school holistically, really, so everybody takes it on.
Can you feel the strength in your thigh?
This school's especially focused on the emotional health and well-being of the children here. They take part in yoga, mindfulness sessions, meditation and massage, all integrated into the school day.
We give the children strategies to cope with learning new spellings and times tables, and we just felt they need strategies to manage their mental health and their emotional well-being. And we just saw all the benefits of it and decided to, as much as possible, get it into the timetable.
Across the school, staff and pupils are embracing the sessions.
It's nice because it relieves stress, and it helps me with my worries, and it can help you concentrate on your work if you're finding anything difficult.
Once we've done it, the classroom becomes quieter, which makes it easier to concentrate. I feel free, so if I have any worries on my mind, they go away in a way.
And the evidence backs up its success.
We've seen an improvement in self-harm rates, we've seen more children getting active, and we've also got more parents getting active. We're seeing improvement in school, and we're also seeing improvement at home.
With the right advice and support, schools in Halton are raising attainment and achievement and moving towards a healthier future.
A recent report by RSPH highlighted the impact social media is having on the health and well-being of younger people. An all-party parliamentary group on social media and young people's mental health and well-being has now been set up to see what can be done to make that impact a more positive one. Carolyn Sim went to Westminster to see the group in action.
This group are all too aware of the negative impact social media can have. As young health champions from Wigan, they've come to Westminster to talk to MPs about the damage sites can do to mental health and well-being.
People just put the perfect life on, when in reality that's not always what it's like. So you then want this perfect life and want to look perfect. So I think when you're looking at that every day, it lowers your self-esteem.
They're seeing images of what's portrayed as a perfect body and they're realising, well, I don't look like that. So they've got less confidence in themselves.
It just carries on for hours and hours through the night. I wake up with messages and sometimes I'm thinking, what was that conversation about? But it's because it's in the middle of the night, it affects my sleep for in the morning.
The scale of the problem was brought to light in a recent report by the Royal Society for Public Health. It found social media is contributing to feelings of anxiety and depression in young people across the UK. It's now set up an all-party parliamentary group to tackle the issue. It's hoped the group will come up with solutions which will drive changes in policy and lead to the introduction of an industry code of conduct. By acting on the negatives and maximising the positives, it's hoped social media will become a far healthier phenomenon.
So I think in terms of calls to action, we've been informed quite a lot from our young people we've spoken to that things like pop-up heavy usage warnings would be great, outlining maybe when filters have been used on posts, for example, on Instagram, if a photo has been quite heavily manipulated digitally, it would be probably helpful for users to see that and understand that that's not reality, not everyone looks like that.
Other young people that we're targeting relate to us more, and it'll sort of make them think about their use of social media and start a chain reaction of people wanting to use it less.
But social media has many positives as well. It connects people to friends and family and acts as a platform for sharing information and advice.
I have a medical illness called colitis, so there's many pages on Twitter what are formed around that. So I go on the UK colitis and Crohn's page and it helps me connect with other people with the same illness.
Hello all, how are you, all right?
At Portcullis House, the group meet with MP Chris Elmore, who's chair of the new parliamentary group.
Nice to meet you. Thank you for coming in.
He was bullied as a child and wonders how he would have coped if that bullying had continued via social media when he was at home.
This is a public health issue and that we do need to start addressing the fact that we have a whole generation of young people that have become so used to using social media as an interactive platform that we need to address it. Across party, across government, it needs to be a response to something that at the moment we're not dealing with as well as I think we could be.
MPs, along with RSPH, will now gather further evidence from charities, mental health organisations and schools. Once this inquiry is complete, the group may recommend changes in the law to help young people who are so afraid of missing out online they risk missing out on real life.
Now, it's a well-known fact that we spend the largest proportion of our adult lives at work, and keeping staff happy and healthy is the key to any good workforce. Rolls-Royce is a company putting well-being at the heart of their business, as healthy staff are more likely to be productive and engaged. Robin Ross went to find out about their much appreciated well-being schemes.
Rolls-Royce is the jewel in the UK's industrial crown. It's been helping to power the world since 1904.
This is Rolls-Royce's Heritage Centre. The company has a rich history and a world-class reputation for building power systems, and they want to take care of the people that help to build them.
There are 30,000 parts in a large civil aircraft engine. This £1 million machine cuts engine components to size, is one of 80 making the workplace safer. The oil-based fluids used to lubricate the cutting process can pose a risk to health.
In the past, with the cutting machines we used to have, they were open to the atmosphere, so the cutting fluids and all the mists would actually go into the atmosphere. So on the modern machines, it's a sealed machine, so all those mists and cutting oils are contained inside the machine itself. And because of this extraction system and the HEPA filters we've got, we're able to make it a lot safer.
Workers used to manually smooth rough edges, running the risk of developing white finger. The machine now does this job, and it's more efficient, helping to speed up the process. The company employs around 50,000 people worldwide. They all do different jobs, from receptionists to engineers.
People who are well and enjoy well-being in all its dimensions they're more engaged, they're more present, they're more productive, they're more innovative, they're more likely to stay, they're more likely to tell good stories about their experience at Rolls-Royce.
The company run an award scheme called Live Well. It recognises sites that create healthy, happy environments. They can achieve bronze to platinum standard awards, helping people with a number of things, such as working better, sleeping better, eating healthier and quitting smoking.
Thanks for coming today, everybody. We're going to have a chat about our Live Well programme.
These resilience workshops teach people how to face and overcome the challenges of their working day.
We're seeing when people are setting meetings up, they're coming to us and saying, how can we make this meeting healthier? So they're asking for input into things like making sure that there's no bowls of sweets on the table, what healthy eating options can we have, how can we have yoga before an event or do some mindful breathing. So we're seeing engagement coming through at all kinds of levels.
So far, just over a third of Rolls-Royce sites have achieved a Live Well award. The aim is to have all the sites accredited by 2020.
From the CEO down, everybody understands that well-being, quite apart from being the right thing to do, is a fantastic business enabler.
Gita suffered from postnatal depression after her third child and turned to a 24/7 helpline set up by Rolls-Royce.
I had a lot of family support and friends around me, but sometimes it wasn't really easy to just offload. So it was really nice to talk to somebody independent. They came across very professional. They helped me put an action plan together, and they just helped me through that difficult time.
I've had a number of communications from individuals who, on the back of interventions that have happened at their sites locally, that they've identified either life-limiting or a chronic condition, which is they've been able to act on and added years to their lives.
Manual workers were complaining of aching limbs. Rolls-Royce worked with them to solve the problem, redesigning workbenches to be adjusted.
Each job contains something completely different, so if I'm just doing patching, I like to have it a bit lower, whereas when I'm doing an assembly, I do like to have it a lot higher.
Of course, if you look after people's health, you look after business.
We saw the improvement in productivity, where individuals just naturally, with the flow of work, were quicker at doing the operations. Workflow coming onto the station was quicker and easier, and just the fact that it was more enjoyable to work at the station is what increased that productivity and the morale of the area.
Rolls-Royce's vision is to lead the way in creating better power, and for that you need people who are healthy and happy.
Living with a medical condition can have an impact on your mental health and well-being, but that shouldn't be the case. Breathe Arts Health Research has created innovative healthcare programmes engaging people through creativity and science, helping people to lead healthier lives. I'm joined now by Richard McDougall from the Breathe Arts Health Research team, and he's here to tell me more about it. So tell me a bit more about what you actually do.
Well,
sounds very intriguing.
Oh, thank you. Breathe Arts Health Research it's a not-for-profit social enterprise, and we use the arts creatively in healthcare. So we have a range of programmes. We have put on 1,400 music events to change the environment in the hospitals, so that benefits patients, doctors, visitors and staff. We put on a programme called Melodies for Mums, which is now helping mothers with postnatal depression. And these are scientifically underpinned to show the efficiency of these programmes. But the programme that I've been most closely associated with is Breathe Magic, which helps one particular patient group, but using magic as the creative tool to reach them.
So tell me a bit more about that then.
So we work with a particular group of young people between 7 and 19 in their age groups, boys and girls, with a condition called hemiplegia, which is a brain injury which has affected one half of their body. So their hand and their upper arm on one side is going to be severely affected and maybe even paralysed. And we have a team of magicians, all of very high standard, all members of the inner magic circle, or the members of the magic circle, and we work with occupational therapists. So they tell us the movements that these young people should be practicing, and then we go away and we create or design magic tricks that have embedded within them all the movements they should be practicing. So it's almost therapy by stealth because they're having a lot of fun at the same time.
You've got a magic trick that you're going to show us, haven't you? Just by magic, you've got something.
So I thought I'd show you
how it actually works in practice.
How it works in practice. I can't explain how it works, obviously, because that would be giving the game away. But I thought what I would do is show you one of the pieces of magic that we teach the young children. It takes them a long time to learn it, but they put the practice in because they want to learn it. So this is the mystery of the jumping ball. And it takes place on a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and the 2 balls have changed. You're not buying it.
No.
Don't worry, it's all right. I'm not selling it. I'll do it one more time for you, and it only takes a count of 10. 1, 2, 3, 4, 5, 6, 7, 8.
My word.
9, 10. And that is a mystery of the jumping ball.
And as you said, what's fascinating watching you close up was the movements that you're doing and how that is very important in terms of the therapy.
And every movement is choreographed and coordinated. That's the beauty about this particular programme, is that we're working so closely with the healthcare professionals. That's where the art and science absolutely meet. Because if breaking this down, every movement has a reason. At the beginning, I said, this was the mystery of the jumping ball. Well, already I have an arm extension. Now, for a young person who may have a weakness in this arm and finds it difficult putting a coat on, that, or a shirt on, that is a good exercise for them to do. This grip of holding the ball just at the fingertip and thumb is good for pinching grips. So for a child whose hand may be fully closed because of their condition of hemiplegia, them wanting to do this is one step closer to doing a button. So the next thing I said was it takes place on a count of 10. Well, now I've got you to open your hands, which again may be very, very challenging for them, but day by day, with close support from the occupational therapist, we can get them to that stage. And then you have wrist extension. You may need that to push open a door. This part, 1, 2, well, to put your hands flat, you may need that at school to hold a book to write on it. 3, 4, you need to be able to turn your hand over and open it flat, if you're at school, for example, to hold a school tray. If you don't want to be the last one at things because you're struggling every day, because everything is a real challenge, and this condition can lead to a lot of mental health issues and low self-esteem, by doing this, you're not only giving them a skill that their friends can't do, and this suddenly makes them a little bit special because they've got this wonderful craft that they can learn and practice, they're actually helping them with their daily living activities so they lead more independent lives.
It must be so satisfying for you personally to be able to share your magic but actually change somebody's life in the way that you do. Can you give me an example of somebody who really, through this magic, has changed
I see
their
it
life?
every time, and it is truly astonishing, and I have to emphasise it is underpinned by science, but a boy of 8 whose hand has been closed all his life and is nervous at school assemblies and doesn't want to be on the school assembly, goes in to show his mother his hands open, and 6 months later was performing this magic trick at the Royal Festival Hall in front of 500 people. Or a girl of 19 at the other end of the scale who's never held a knife and fork before is cutting her food in 10 days and then going off to university. So it's not just for the individual child, the ripple effect for the parents, for the siblings. It's art in healthcare is massively, massively powerful.
Well, it's fantastic that you've been able to share your magic story with us. I know you're not going to tell me how to do the trick, but it's been great to meet you. Thank you so much. Thank you. Holidays with friends or family are precious times, so it's understandable that people want to stay well and healthy while they're away. Well, this is a top priority for holiday provider Bourne Leisure, who own Butlins, Haven and Warner Leisure. Bourne Leisure is RSPH accredited for its prevention and control of norovirus training programme. We sent Jonathan Gibson to Thoresby Hall Hotel in Nottinghamshire to find out if it's winning the battle against the bugs.
At Warner Leisure's Thoresby Hall Hotel, making sure guests enjoy their stay is everyone's priority.
We have 3 brands. We have the Haven brand, we have the Butlins brand, and Warner Leisure Hotels. Over 4 million people will holiday at one of the 3 brands that I mentioned at some time during the year. It stands to reason that we're going to have issues. So we have a really robust policy around how we deal with norovirus outbreaks within the business.
Past experience has taught Bourne Leisure it has to take norovirus seriously. If an outbreak gets out of control, it can force venues to close completely.
The most important thing if you have a suspected norovirus outbreak is to take immediate action. Where you've got lots of people in the same environment, you've always got a potential issue with norovirus spreading. It's extremely contagious. Training and planning is absolutely critical. The people who are going to be cleaning up need to know exactly what to do, where to go to get the things that they need for cleaning up, and more importantly, how to prevent the spread from themselves to other people.
That starts with induction training for every new member of Bourne Leisure staff.
So this is pretend bacteria and viruses, if you like.
Most people know what norovirus is, but they need to know how to stop it spreading. This UV-sensitive gel is used to drive home the importance of effective hand washing.
So often what happens is people don't bother using soap, or they don't bother really doing very much. So just a quick flick, and they think, well, that'll do.
Under UV light, I'm in for a shock.
So what this is demonstrating is that if you don't actually wash your hands really well, then you could still have viruses and bacteria on your hands even after washing.
A good wash later.
You need to put your nails into the palm of your hand. Then you need to go between your fingers.
I try again.
Much better. Much better. Yeah, you've still got a little bit here. So if that were norovirus on your hands, that means you'd be able to spread it around the hotel onto surfaces which could be picked up by other guests.
Getting that message across to staff is what the outbreak game is all about.
OK, so we'll give one set of rules to you guys.
It was developed by Bourne Leisure in-house to keep norovirus on everyone's radar.
When team come to do the refresher training, they'll sit down and play the card game, which has a number of potential norovirus scenarios, and they have to pitch them into green, amber or red, which are our stages of norovirus action plans.
Vigilance is key to preventing infection, so even before an outbreak occurs, preventative steps are put in place, what's called the green response. That means guests are always encouraged to sanitise hands, and workers are reminded to keep a note when guests buy certain medications.
A lot of our team may not have heard of it before, so it raises awareness about what it is and what to do.
If an outbreak occurs and starts to spread, the site may move to Amber Alert. Menus and other items will be removed from display to reduce the risk of cross-infection. Managers are also kept in the loop, not just on site, but across the group.
And at that point, we can contact the site and say, have you got everything you need in terms of equipment? Do you need any support? And at the same time, we'll send communication out to all our other sites saying, such and such a site might have a problem, do not travel to it. And similarly, people will not travel from that site to any other sites in our business.
The aim is to try to contain the outbreak so it doesn't become a red alert. By this stage, every infected room has to be individually deep cleaned. It's a time-consuming and costly process, which in the worst case can close a hotel completely. And what's the reality of having to kind of deal with an outbreak?
It's a lot of hard work. There's a lot of communication that has to go into place with going from team members through to management, daily meetings, that sort of thing. There's a lot of work to it to keep it under control.
And that's what's so good about the Bourne Leisure system, is that they're ready, they're poised for action, so that they can tackle any problems straight away rather than waiting for it to get hold.
A proactive approach to infection control, protecting both guests and the business.
Thank you for watching A Place for the Public's Health. We hope you've enjoyed this programme. All of our reports are available to view on the RSPH website. The details are on the screen now. From me and the rest of the team here, thank you for watching. Goodbye.